Hi there, Mr. Mancini. My name is Hiba. I'm a level 2 nursing student. I'll be your student nurse today. Before we get started, do you mind telling me your full name and your birthday just so I can check against your wristband? Perfect. So today I'm just here to go through with some doctor's orders to give you heparin subcutaneously and Haldol intramuscularly. Before we get started, do you have any questions for me? No? Any allergies? Perfect. I'm just going to go get set up with my injections and I'll be right back. So once we're preparing medication, before we get started, we want to check our MARS and go over the 8 rights of medication. So we have to confirm that it's the right patient, right medication, right dose, right time, right route, frequency, right site, and right reason for the medication. Once all 8 have been confirmed, we can then go on to pick the correct needle size according to Mr. Mancini. So based on our physical assessment when we first walked in, we know that he's a male and that he is of normal average build. So for the IM injection, we would pick a 21 gauge and 1.5 inches. And for the sub-Q, we would pick our 25 gauge with 5/8 of an inch. So before I get started with touching any medication, I want to make sure I perform hand hygiene. We will do this again when we enter Mr. Mancini's room just to make sure we're following sterile technique. So once we pull our medication, we know Haldol, which is the IM one, comes at 4 milligrams per 2 ml in this ampule, and the order is only for 1 milligram IM, so we would only pull out half a milliliter. And for our heparin, it says 5,000 units subcutaneously, which comes in a 1 milligram ampule, which we would just administer the full milligram. So after checking Mr. Mancini's MAR, we do see that he's allergic to codeine, but that's not being administered today, so that has been checked. We do also know that we need 1.5 inches for the IM because the muscle is further down with Mr. Mancini, and only 5/8 of an inch with the sub-Q because it will be higher up, so we don't need to go as deep. With the gauge sizes, we have 21 for IM and 25 for sub-Q, just because the diameter doesn't need to be too big for the medication that is being administered. We will begin by taking an alcohol swab and just wiping the top of our ampule to make sure, just for a couple seconds, make sure we cover all our top and throw it out. We'll then take our needle and fill it up with the amount of air that we're putting in, the amount of dose we're putting in, so that'll be 0.5 ml. Making sure not to touch the plunger portion as that is also considered sterile. We will then take off the cap and insert it into the ampule. We'll then lift it up and inject the air in. And while we can see the label as well as the milliliters, we'll pull back until it reaches the dose we need, which is 0.5. Once that is done, we can return it down and make sure to check for air bubbles, and we can put the cap back on the needle. And we will also label the medication as soon as we do it with the right patient and right. Next, we'll prepare our heparin, which is our subcutaneous. We'll do the same with taking a new alcohol swab and just wiping the top, making sure to cover the whole area. And we will take our needle for the subcutaneous, and the order says we need 5,000 units per 1 ml, and we need 5,000 units, so we'll just take a whole milliliter. We do the same with pulling in a milliliter, making sure again not to touch the plunger portion. Insert it into the ampule, insert the air as well, and lifting it up, making sure we can see the label and the dose, and pulling back a milliliter. Perfect. We will set it down and make sure for any air bubbles that we tap out. And that is the subcutaneous. We put the cap back on as well as we label this as the heparin, subcutaneous, with the right medication and right patient information. So before or as I'm entering Mr. Mancini's room, I'll make sure again to perform hand hygiene, as well as put on my sterile gloves while talking to Mr. Mancini and confirming his wristband and my Mars with the dose ordered. So Mr. Mancini, do you mind telling me your name and your date of birth again? And I would check that that's correct with the Mars. Any allergies? Codeine, again, confirmed with the Mars and the medication. Then we would, for our subcutaneous first, we would make sure that we're administering to the right site. So for subcutaneous, the lower abdomen, the anterior thigh, or the back of the arm are appropriate sites. So as we're taking our alcohol swab and sanitizing the lower abdomen, I'm just going to take this time to inspect for any bruising, redness, any signs of abnormalities, just to make sure we're not adding heparin into an area that is hurt or bruised at all. So once we're done sanitizing in a circular motion 2 inches out, we're going to take our heparin, check again with the wristband and the order, take our cap off, and we want to pinch the skin, not too close as to inject ourselves, and go in at a 45-degree angle. We don't need to go in all the way, just until we hit subcutaneous, and inject, and then remove our needle and recap it on the table. Once I've capped my needle, I want to make sure to put it directly into the sharps container so that there's no pricking anybody with that. As well with heparin, we want to make sure to not rub or anything, but apply some pressure onto the lower abdomen, just making sure that it has time to clot. So next we'll be doing our IM injection. There are 3 appropriate places for the IM to go: the vastus lateralis, the ventral gluteal, or the deltoid. So for Mr. Mancini specifically, we're going to be going into the deltoid, which is just the top of the arm. We're going to first landmark his acromion process and go about 2 fingers down and just into that muscle there. I'm going to be demonstrating on here. So assuming this was the deltoid, I would then again sanitize, circular motion 2 inches out. So once I've sanitized appropriately, I'm going to take my needle, check again with Mr. Mancini that it's the right medication. I will then uncap my needle, and since we're using a bigger needle, we don't need to go the whole way in. So making sure not to pinch the skin, just holding steady. I would let Mr. Mancini know that I'm not going to inject him. Go on 90 degrees like a dart, just until I hit muscle. If I pull back and I see any red streaks, I've gone wrong and I need to start again, but since we're not seeing any here, I'm just going to inject, in, remove, hold it there for a couple seconds, and do the safety mechanism for my needle, as well as throw it out. Mr. Mancini gets his needles, we can take off our gloves, just talk to him, make sure he's doing okay with the medication and that he feels okay. Perform hand hygiene, just with some sanitization. We would also then document what gauge of needle we used, how Mr. Mancini tolerated it, as well as go and complete our Mars and make sure everything is documented that he got his medications today.